I'm happy to be with you today talking about perimenopause, and in particular, focusing on things that I think are most appropriate for women living with HIV. So my expertise in perimenopause comes because I had a horrible time. And so I learned from my own experiences, and I learned from the experiences of my patients and the people that were in studies working with me. But I also have reviewed the literature and tried to understand what's going on in a very confusing time of life. So if it'll let me move the slide. Oh, no, there we go. I want to say before I start that I am deeply grateful to the Coast Salish peoples for their guardianship and care of these lands that I live on, that I have no commercial interests, and that I'm shamelessly proud and think progesterone, this picture here, is beautiful. Oh, let's go forward. How about that one? I don't know what's happening there. There, okay, let's try again. Okay, so I want to give you the perspective that perimenopause is the start of something new, as evidenced by these spring flowers. But it isn't that we're getting old. An example is this twisted Gary oak, something unique to the coast of BC. So it is a new thing. It is not us being old, and it is time to take an assessment and in some ways to put ourselves first if we've been a caregiver for everyone else in our lives. So we're going to talk first about some confusing definitions. Then I want you to understand the hormonal changes. Next, those experience changes that we know are related to the hormonal changes, and then how to deal with this. And finally, that we now have something that's effective for the night sweats and sleep disturbance of perimenopause, that's safe for women living with HIV. So I think of perimenopause as the ovaries' grand finale. Why? Because we have these follicles, the cells surrounding an egg, that are packed into both ovaries. And the job of perimenopause is to get rid of them so that we don't get a period when we're in our 80s or 90s. And how does the ovary and the system get rid of them? By stimulating them. They make a lot of estrogen. Things are chaotic. It's like the end of a fireworks show. So let's start with some definitions, because people are forever mixing up perimenopause and menopause. So if you ask 3 people what menopause, that word, means, most women would say menopause is everything changing and awful about getting older. But if you ask a gynecologist, who are the surgical specialists in women's health, they will say menopause is the final menstrual period. But the reality is that you only know you're in menopause when a full 12 months have passed and you haven't had another period. So epidemiology and the World Health Organization say menopause is women's final life phase that begins a year after the last menstruation. So what we're talking about today is not menopause. We're talking about the transition to menopause. So just a couple of other things. Why do people mix up perimenopause and menopause? Because, first of all, both phases are perfectly normal. both have relative or absolute infertility, both have hot flushes and night sweats, and both have sleep problems. So that's kind of understandable that people are mixing them up. But what's important, and I don't want you ever to mix them up again, is that perimenopause and menopause do not share. And it's only perimenopause that has mood swings, depression, anxiety, breast tenderness, mental fog, or heavy flow. Those are not menopause things. Okay? All right. So again, before we get into the nitty-gritty of hormonal changes, I want to give you a kind of a map. And it's a bit confusing, but I'm using standard terminology here. So menopause transition is used for part of perimenopause. Perimenopause is a bigger thing than menopause transition. So very early perimenopause is not currently recognized, but it is absolutely real. And it's a time when your cycles haven't changed, but you know darn well that you feel different. Okay? I will talk about what those changes in experiences are. But what's not happening in that first period, and mine was 5 years long, and we haven't documented it because we don't recognize it. Then we get to a point, which is a bit of progress actually, when cycles become clearly irregular. That's called the early menopause transition. And then, happily, you get to a point where you skip your first period. And we know from some studies that that happens in Caucasian North American women at about 48 years of age. I should say that the normal span of perimenopause is anywhere from 35 to even 57 years of age. Okay? Now, the final menstruation, you don't know it is final until you've been a full year. You start the 12-month clock, and it's so exciting when you realize I'm 12 months without a period. I graduated into menopause because menopause is much easier to cope with. Menopause is a walk in the park. At least it was for me and for women who have problematic perimenopause. Okay, so what hormonal changes? We'll talk hormonal changes first, and then we'll talk experience changes. How's this for weird? Someone in their 40s who has a vivid dream that they're pregnant. This appears to be kind of an archetypal experience. I had it, and once, a long time ago, I was talking to an audience about this, describing it, and somebody at the back of the hall piped up and said, "That's not a dream, that's a nightmare." And it is, because most of us have already had the children that we want. But the changes of perimenopause subconsciously remind us of being pregnant. And this kind of a dream was also recorded by a nomadic Kong woman of the Kalahari Desert. So it's not a white person's thing. It seems to be universal. Okay, so when we're trying to understand what to expect, I always go to the least biased sample of people's experience and record keeping and hormones that I can find. And I'm using here Melbourne Midlife Women's Health Study. They used voting records to randomly sample women ages 45 to 55 who lived in Melbourne, Australia. They needed to not be on hormones, to still have their uterus, not taking the pill, and to have had at least 3 months of flow before they entered the study, because it was planned as a longitudinal study. So 438 of the women who were invited or a little over half of all of those, agreed to be in the study. And their average age was 49. Their BMI was a healthy 25.9, and most of them had had mammograms, fewer than the usual in the society, or smokers. And that's pretty common in most studies. So what they decided, that the investigators decided to do, was to measure a blood progesterone estrogen level early in the cycle days 3 to 8, first thing in the morning, once each year. And here are the data. Now, it looks confusing. Don't worry about it. I'll explain it clearly. Each dot is an individual person's blood test, okay? I think you can see immediately how variable these dots are. From way up here, or even higher here, to way down here. Now, I've drawn lines across this graph and also put color shading in, because since it was early in the cycle, the hormone levels should be clustered around this in this yellow bar. But look at how many of them are outside of that yellow bar. Now look, here's the highest that ever estrogen gets in a premenopausal woman's menstrual cycle. And look at how many are higher than that. And many are up in this red zone up here, or pink, I guess. And that's true whether these are women who, remember, they're 45 to 55, who have regular cycles, or they're women who've been without a period for 3 to 12 months. Look at this. Incredible. All right, so this data shows that estrogen levels are variable and that they're high. And those are the messages that I want you to take away. And those are not the messages that you're going to get from the usual clinician or the family doctor who's been taught by gynecology. Okay, so estrogen is just all over the map. What's happening with progesterone? And here I'm going to show you data from a single person who was in a one-year study that I did way back in the 1980s. So first, an orientation. So this is when she was in the study up at top, and here's 10 years later. So each turquoise bar is her cycle length. So she's got a cycle length about 29 days on average, and it's pretty regular, perfectly normal. The yellow bars are the length of what's called the luteal phase, or the time in the cycle from ovulation, egg release, until the next flow. The luteal phase length needs to be 10 days for it to be a healthy cycle and for it to be a fertile cycle. So every one of her luteal phase lengths are normal, meaning her progesterone levels were normal, except for one during that whole year. Well, it happened that she moved out of Vancouver. 10 years later, she wrote me a letter and she said, I'm having these horrible heavy flows. I'm waking in the night sweating. Can you help me? And so I began to ask her questions. And I learned that she'd been keeping the same diary. She'd been keeping her basal temperature. And therefore, she had a record. So we matched the months from the early cycles with the months now 10 years exactly later. And I think you can see that she still has regular cycle lengths. They're a bit shorter, statistically shorter actually, but now look what's happened to her progesterone. Not a single cycle has a normal luteal phase length, meaning they all have lower than normal progesterone, and 2 cycles didn't ovulate at all. She was clearly in early perimenopause, very early perimenopause. So in very early perimenopause, progesterone levels are already dropping and estrogen levels are already chaotic and higher. Okay, so that's talking about the ovary. What's happening in the brain? Well, it turns out that when estrogen, hits that peak, it has to come down. When it's downswings, the brain sees that as an emergency and sends out every single neurotransmitter, stress hormone that it knows how to make. Literally, everything that we know the brain makes increases when estrogen levels drop. If you think about it, it's very similar to someone having hypoglycemia who has diabetes. The low blood sugar is an emergency signal to the brain. The result of that is that the central part of the brain makes higher norepinephrine, a stress hormone, adrenaline, if you want to use a common word for it. Plus, there's signals from the brain and pituitary that go to the adrenal to make higher cortisol levels, another stress hormone. So it turns out that these downswings of estrogen cause night sweats and hot flushes. They also cause rapid bone loss, and bone loss is more rapid just before menopause than it is in menopause, early in menopause. And also, these downswings are associated with depression. This is the fundamental thing that seems to be missing in the message women get about what's going on. Is the ovaries going crazy, and the ovaries going crazy because the connections with the brain are broken on purpose to let the ovaries get rid of all those follicles it doesn't need anymore. But when estrogen levels soar and then drop, the brain reacts. Now, don't get me wrong. Only 15 to 30 of every 100 perimenopausal women are highly symptomatic. You would think from people who are talking about it that perimenopause is always horrible. Well, it isn't. Happily, it isn't. And I was complaining to my mom's first cousin, someone her age, and a mentor actually for me, that I was having these horrible night sweats and hot flushes, and she didn't have them, my mom didn't have them, my sister didn't have them. How come? Well, I was one of that 15 to 30, even though genetically I'm related to those people. So don't expect it to be a catastrophe. But if it is, be prepared to understand what's going on. Okay, so what are the things that women experience? And here I've gone back to the Melbourne randomized controlled trial, randomized prospective observational study, and made a kind of chart of things that greater than 30%, greater than or equal to 30% of women in that study reported experiencing. Now, remember, these were questionnaire studies. And so if you didn't ask them about some of these things, they may not have said they had it. Okay, just so you understand. But fatigue is common throughout, from early perimenopause to late perimenopause. Depression is most frequent in that late transition after you've skipped a period. The same is true for depression. Headaches, not worse. Aches and pains, worse, a little bit. Trouble sleeping tends to be worse than. Nervous feelings, hot flushes, definitely worse than. Night sweats also. But look at what happens with breast tenderness. It decreases, and that's kind of a mark of high estrogen. It's most problematic, as is heavy flow, in very early perimenopause. And that's a problem because it is before the official recognition of that a person is in perimenopause, since most doctors now believe perimenopause only begins when you start to have funny periods. Okay, so we've talked about the hormones, we've talked about the experience changes. How will we deal with this? Well, strategies that I developed for myself and that I also shared with my patients. First of all, it's really important to understand you're not old. This is happening in midlife. It's not happening to elders like me. And that we will all, even if it's miserable, we will survive perimenopause. The second message is probably the most important. Avoid estrogen therapy till you're clearly in menopause. And even then, you may not need it, even if you have night sweats and hot flushes, because randomized controlled trial data show oral micronized progesterone is effective for hot flushes in menopause. The third one is a hard one for some of us, but it says, take care of yourself. I mean, that means saying, no, I'm sorry, I'm busy. I can't, do that thing for this committee. I can't, do this thing for my 12-year-old. If you don't like what I make in your lunch, you can make it yourself. But think about the things that make you feel the best. For me, it's reading a book and listening to classical music, Baroque, ideally. So I did that to take care of myself. Another is something active, walk or exercise. Excuse me, I'm just getting over a flu. At least 30 minutes a day. You may not feel like doing it, but do it. And if you can do it outdoors, and think about the birds, think about the snow that's falling in Vancouver today, do it. Remember I said, sorry. Remember I said that the brain was making high stress hormones? Mindfulness, meditation, yoga breathing, things that center you and calm you down are going to be lifesavers in perimenopause. Now, remember I said that there's rapid bone loss in perimenopause. On the Center for Menstrual Cycle or CEMCOR website, there's ABCs of midlife bone health. That's worth looking up, especially if you have osteoporosis in your family. And finally, if you're struggling with waking in the middle of the night, cyclic or daily progesterone therapy will help. Now, I'm going to show you the data in a minute here. So let's talk about progesterone. Remember I said that it was lower? It was lower already in a woman who still had regular periods, who was still ovulating. So estrogen's too high and progesterone is dropping. Well, the two are meant to counterbalance each other. Progesterone isn't going to stop estrogen from getting high, but it does mitigate the experience, the body experiences of too high estrogen. Okay. All right, so I learned for myself, because I did not want to take estrogen and I knew my own estrogen was high, that progesterone would help me. In fact, I'm a before baby boomer, so there was almost nothing about perimenopause when I hit it in the late 80s, early 90s. And I learned from my experience with treating symptomatic perimenopausal women that progesterone was effective. And so in 2011, we got funding from CIHR to do a randomized controlled trial. We initially intended to do it only in Vancouver, but perimenopausal women are busy. No matter how symptomatic they are, they're still just overly committed. And we ended up doing mostly remote enrollment. And as I like to say, from Nunavut, literally, to Nanaimo. The mean age of the 189 women was 50, and their BMI was 26.8, just into the overweight range. The majority had graduated from university, and as I said, most participated remotely from all across Canada, from the territories, etc. Again, the majority had skipped a cycle. They were in late perimenopause. Okay, so our primary outcome, we did 1 month in which they recorded a diary of their night sweats and hot flushes as a baseline. And then we did 3 months of therapy. And the third month average vasomotor symptom, or VMS score, was the primary outcome. However, that was not significant, which was really discouraging. Why? We knew that 100 menopausal women was plenty to do a randomized therapy trial. But we had almost double that number. And the reason is that perimenopause is so variable. I'll show you that in a second. But thankfully, we added secondary outcomes that were significant. And these are things that women perceived as changes. So we asked them, how did you feel about changes in hot flushes? How did you feel about night sweats, about periods, about sleep? And we also ask another question. On a line from 1 to 10, how much does perimenopause interfere with your daily life? And it turned out that those who were on progesterone had a much less interference than those who were on placebo. We also were asked by the data monitoring board to do a screening questionnaire for depression initially, which we did, but we also did it at the end of the study. And there was no difference between progesterone and placebo. I'm going to show you the results, but here's the link to the study. It's open access. You can read it for yourself if you like. Okay, so here, this looks familiar, doesn't it? Dot plot. Each one of these is an individual's experience when they were on no therapy. The blue is those assigned to progesterone subsequently, and those assigned to placebo. So they were pretty well matched. And you can see that those on progesterone had a decrease, but it wasn't significantly different because look at how variable hot flushes are for this group of women who were not that dissimilar. So to give those who have numbers savvy an idea, the mean was 12 and the standard deviation was 11, which is hugely variable. Okay, so here are the positive, definite results from this study. We asked women what changes they perceived in daytime hot flushes. And this is no change. So you can see that they decreased a lot, but they decreased some on placebo as well. And that's true of every hot flush study that's ever done. How about night sweats? They decreased, but they decreased significantly more than those who were on placebo now. So night sweats were significantly improved. Daytime hot flushes, actually women said that the intensity of the hot flush was improved, but not the number. How about the heaviness of menstrual flow? Well, it decreased it looks like it decreased a lot more, but it wasn't statistically significant. See, the mean here is no change. And that was true for both placebo and progesterone. In other words, progesterone didn't change periods at all. It simply wasn't, even in a full dose of 300 milligrams at bedtime, it wasn't strong enough to take the period away, which is kind of reassuring, actually. So then you can tell when you hit menopause. How about changes in sleep quality? And here, there's an increase, whereas there was no mean change in those on placebo, a highly significant difference. So sleep quality was markedly improved, and that often is a salvation for someone in perimenopause. So let's summarize. I've been through a lot of complicated things, and it's likely to be a different way of understanding perimenopause than you've heard before. But first of all, perimenopause is a time of change, getting rid of all those extra follicles. Before menopause, which starts after 1 year without any period. So again, this funny language business, I don't believe in using the word post-menopause. That's like saying menopause. So menopause itself is the thing that starts after a year without flow. So in perimenopause, estrogen increases and is erratic, progesterone decreases, and stress hormones are high. This is a time when that high estrogen, not counterbalanced by progesterone, can cause heavy flow, unpredictable cycles, night sweats, sleep problems, increased PMS, especially early in that very early perimenopause phase. It's important, however, to understand perimenopause misery ends, and that we can help ourselves by eating healthily, exercising regularly, having friends we can just tell all our miseries to and that aren't going to try to fix it. They'll just listen. And if you really do need help, progesterone promotes healthy aging. I didn't go into that, but there's evidence that effectively treating hot flushes and night sweats is associated with improved cardiac heart health and also improved bone health. And progesterone treats night sweats is the only thing that's hormonally effective for sleep problems. Estrogen itself is not. It increases bone formation and it decreases heart attacks. So treating hot flushes, first of all, is important. Treating them with progesterone is even more important. So perimenopause can be problematic, but with support, with knowledge, with taking time out to take care of yourself, you too can survive it. Thank you very much.